Traditionally, cancer has been treated with medications which are termed chemotherapy. If you look at the term chemotherapy, it's basically consisting of two words, chemo and therapy. Chemo comes from the term chemical and therapy is treatment. Traditional treatments for cancer involved treating patients with different types of chemicals which were given through the intravenous route. That is, you put a needle through the vein and give the chemotherapy through there. Over the years, as a lot of research has been done in how to treat cancers, we have developed different medications which are not just chemotherapy in the traditional sense. They include medications which act by targeting specific proteins on the surface of cancer cells called targeted therapy, or actually revving up your own immune cells to target cancer cells, which is called immunotherapy. So when we talk about chemotherapy today, it is a whole new realm of medications which involves regular traditional chemotherapy, targeted therapy, immunotherapy, and other medications which basically target the surface of cancer cells to help control the tumor. Cancer is a type of cell which is mutated from your own cell and has lost all control of how it divides. It mutates and it keeps dividing and dividing and dividing with no control, and doesn't follow the normal rules of what your normal cells do. It doesn't stay stuck around at one place, moves around, spreads around. So you have to use an agent which acts on these cells which are dividing fast. Chemotherapy is one of that medication. It is given through the intravenous route, so it goes into your bloodstream and tackles these cells. So even if we see a cancer which is there as a tumor in one place, we are concerned whether cells from this cancer have broken and spread other places. So you need a treatment that not only targets that particular tumor, but other places the cancer might have spread. And that's why when we do treatments, it is a combination of medications. It's a combination of treatments. You do it with chemo, radiation, surgery, because you want to take care of all these things together. So if when we start talking about chemo, yes, your doctor is going to talk to you about what kind of cancer you have. Treatment would depend on the type of cancer because there are lots of different chemo agents available, and it could be a combination or a single medication that is used depending on your type of cancer.